So a hernia is any defect in the abdominal wall that allows contents from the abdomen to exit the body underneath the skin. Typically, they're noted when a child cries. Parents will see a bulge in the area of the hernia, typically either the belly button or in the groin. Well, there are two types of hernias in children. One is called an umbilical hernia, which is a fancy term for a belly button hernia, and those are very, very common. We generally don't need to treat those surgically in the early years of life because 97% of them will eventually close by the time children are 4 or 5 years old. And so in general, when we repair those, we wait until the children are at least 4 or 5 years old because we know that most of them will close by themselves. So the inguinal hernias are, in contrast to the umbilical hernia, much more urgent in the need for repair. So the inguinal hernia is a hernia that occurs as a normal part of the developmental process. In most children, the inguinal canal, which is present in fetal life, closes by itself. In a proportion of children, it does not close by itself and can actually enlarge. And when that occurs, when children cry, they'll usually see a bump in their groin. The reason those need to be repaired is that when children cry, the intestine will pop out, and that's what is actually causing that lump in their groin, and the intestine can twist on itself and lose the blood supply. So we know when we do see those should be repaired in a few weeks. For umbilical hernia repair, the traditional repair is making a little smiley face incision underneath the belly button. We go down and find the hernia sac and divide the hernia sac and then close the abdominal wall with some absorbable sutures and then close the skin back over. So the procedure usually lasts about 45 minutes to an hour. And babies generally do fairly well after, children generally do fairly well after that with a recovery time of a few days. The inguinal hernia repair is one that traditionally has been done through a small little groin incision over the area of the inguinal hernia. We would go down and divide the normal tissues above that muscular tunnel and then open up the roof of the canal and separate the hernia sac from the other important structures that run in the canal, suture that hernia sac closed, and then close things back up. Now, we know that there's a lot of disruption of normal anatomy when we do that, so that technique has evolved over the last several years to now include a laparoscopic approach to that same repair, where we make a very small incision in the belly button, put a camera through the belly button, and then place a suture around that same hernia sac by using laparoscopic guidance to help place that suture. And that results in a hernia repair through very, very small incisions, usually no more than a couple of millimeters in size, although it does require 2 or 3 small incisions. So the advantages of doing it laparoscopically are less pain for the child and a shorter procedure for the child, so less time that's necessary to be under a general anesthetic for the repair. All we operate on are children, and so this is what we do every single day. And the laparoscopic repair really is not done by the adult general surgeons, given the extra training that is required to perform a laparoscopic inguinal hernia repair. But in any term baby or older child, it is an outpatient procedure. So the patient comes in with their parents, they undergo their anesthetic and their inguinal hernia repair or their umbilical hernia repair, and then generally we'll go to the recovery room for an hour or so and then go home. Not only is kind of our training as pediatric surgeons important, but the whole healthcare team that takes care of your child. So everywhere from the nurses to the pediatric anesthesiologists to the general patient experience is all focused on the child and their well-being.